Lots of influences have made our culture really amazingly complex and quite beautiful. At the same time, some of the outward influences from well-meaning people brought in things like tobacco.
Twice as many Alaska Native adults use tobacco as compared to non-natives living in Alaska.
Values that can be utilized to help somebody choose not to use tobacco in my culture would be the value of family.
I grew up in a home that, my dad smoked. We saw it modeled in the home. Tobacco use was a regular part of adults around us. The more adults that don't use tobacco, the more kids don't see that as a social norm. And so you see that trend change.
The population we need to be focusing our efforts on is the Alaska Native population. The Leadership for Eliminating Alaskan Disparities is a statewide work group, really diverse group of about 17 people that participated in the strategic planning effort. People that come from our tribal health network. There are people that represent young adults. Even people from the Alaska Native Health Board were on the executive committee that kind of endorsed the strategic plan. We developed some guiding principles to update the strategic plan. We wanted to make it very action-oriented, so the things that came out of the strategic plan should be things that could work on the ground in our communities across Alaska. We wanted the plan to really complement efforts that are already underway, so things that our grantees are already doing and things that the Alaska Tobacco Control Alliance is already doing. We know that Alaska Natives smoke at a much higher rate than the population as a whole. Adult smoking prevalence is around 19%. The Alaska Native adult smoking prevalence, 43%. Smoking among Alaska Native youth is around 25%. Smoking among non-Native youth is around 14%. Smokeless tobacco prevalence among all adults is around 5%. Alaska Natives is at 12%.
I remember years ago, there was smoking in the hospital out in the waiting room, and I heard a man coughing. And he had emphysema. And my question to the board members, we're treating a man with emphysema and we're allowing smoking in here. And over years, the change started on tobacco cessation.
They had a huge critical mass of folks that said, this isn't a good thing for our people and we want to have a tobacco-free campus. Their board of directors helped to push something through that people said there's no way that that's going to happen.
And that was a proud day for us, not allowing any cigarettes or smoking on the campus. It started at Search. All the rest of the hospitals in the state of Alaska followed their lead.
Outside Alaska, hospitals looked at us and said, if they can do that in Alaska, we ought to be able to do it in Nebraska or California.
But what Search did was open the door.
Very soon after, Alaska Native Medical Center became tobacco-free. From the Alaska Native community, of course, we face a great disparity, but we also have the support of great leadership that says this is something really important and our health care facilities should be health care facilities, and as such will be tobacco-free.
No smoking allowed. It's great.
There was a final, timely submitted resolution submitted within the terms of suspension of the rules. The resolution is entitled Statewide Smoke-Free Workplaces to Protect Tribal Citizens from the Dangers of Secondhand Smoke. Is there a motion to suspend the rules to consider this resolution?
And whereas it has been determined by the United States Surgeon General that there is no safe level of exposure to secondhand smoke, air ventilation systems do not work, and that only completely smoke-free environments can protect health, and whereas a significant amount of secondhand smoke exposure to Alaska Native adults and children occurs in the workplace, and even short exposure may result in serious adverse health effects and even death. And Alaska Native people have taken a lead in addressing health issues throughout the years. And whereas smoke-free places will protect the health of our children, grandchildren, families, community members, and now therefore be it resolved that the delegates of the 2011 Annual Convention of the Alaska Federation of Natives Incorporated support statewide smoke-free workplaces to protect Alaska Native people from the known dangers of secondhand smoke.
Yes, my name is Ralph Hemlock, and I have a nephew that has died from secondhand smoke in Fairbanks. He was the son of George and Pauline Yasko of Tanana. He was playing pangingi with a lot of the people there. They all smoked, but he didn't. He died from secondhand smoke.
7 as amended signify by saying aye. Aye. All those opposed say nay. The resolution is adopted.
The tobacco settlement money helps fund a variety of evidence-based activities, all following best practices established by the National Centers for Disease Control and Prevention and what works best for Alaska. Today, there's a powerful groundswell of activity across Alaska. Individuals, coalitions, organizations, and businesses championing the cause to end tobacco-related death and disease.
Quitline is a free and confidential service to all Alaskans. They can get free nicotine replacement treatment for 8 weeks. They can call their quit coach as many times as they like. It's a support, especially for folks maybe in rural and remote Alaska. They might not have access to a tobacco cessation program.
Depending where you are regionally in the state, it varies what the use rate is. We offer a full range of service. That would be one-to-one counseling or family counseling or group counseling, and then also pharmacotherapy.
The influence you can have as a relative to somebody is a powerful thing. Challenging somebody towards a positive lifestyle is always heard when it's coming from family.
It's those voices, I think, and that's where, you know, in culture, when you look at a group of people like elders, which are valued, and that's a very positive part of culture, is we do value elders, and also children.
I think the media is doing a wonderful job, but we can do more. Prevention is still the best medicine. The Native community needs to step up. If you're a leader, encourage your people not to smoke. Whether you're Native or non-Native, it's important to get this message out.
We're talking about saving lives and protecting the people that we love.
Elders and children, hugely valued in Alaska and traditional culture. And it's one of those where when you look at things that affect them, like tobacco, it makes decisions really, really clear. It's like, of course.